cleaned my supplies, checked my doctor's orders, checked all expiration dates, and performed hand hygiene. Now I'm gonna go see my patient. Knock, knock, knock. Provide privacy. Hi, my name's Hannah. I'm a student nurse with Austin Community College. Can I see your armband? Can I get your name and date of birth? Okay, thank you. Do you have any allergies? No allergies, great, okay. So I'm gonna go ahead and lift your bed up. Today I'm going to be giving you some pain medication, some morphine, and then I'll be inserting a catheter for your urinary retention. Do you have any questions? No? All right, so to get started, I'm gonna go ahead and draw up your meds. It's in a new package. So I've already performed my first check, which was my doctor's orders to the MAR. And now for my second check, I will be checking the vial to the MAR, which I have right here. Everything matches up, expiration date is good. So now I can start drawing up my med. Start by swabbing for 15 seconds. I'll let it dry. Dose is 0.4 mLs. So I'll inject air first. And draw back the amount. All right, and I'm gonna go ahead and label it with the medication name, my initials, and the dose. And then before I administer, I'm gonna do my third medication check. Can I have your name and date of birth? Everything matches up with the MAR. Now I'm going to start administering. The infusion rate for my medication, morphine, is over 4 minutes. I'm gonna start by cleaning the hub for 15 seconds. And then I will put in some saline, 3 mLs. Okay. Now I'm gonna clean it again. 15 seconds. I'll put this in the sharps container. And I'll push this at a rate of 4 minutes. But for time purposes, I'm just gonna push it in. And then after this, I would go ahead and flush again with normal saline. But I'm going to flush 3 mLs at the rate of infusion. So for 4 minutes. Now that I've finished the IV push medication, I'm gonna go ahead and get started with the catheter. First, I'll clean up my work area. Dispose of everything properly. patient had pericare this morning, so I don't need to do anything about that. I'm going to place a waterproof pad under my patient. Okay, perfect. And my patient is in the dorsal recumbent position. So now I'm going to open my catheter kit. Oh, by the way, for my IV push, I would have documented the 8 rights, which are right patient, right medication, right dose, right frequency, right route, right reason, right documentation, and right response. And for an IV push, I would check in 15 minutes for the response. Now I'm going to make a trap bag out of this. I'm just going to move my patient up in bed slightly to have more room down here to work. I'm going to start opening away from me. Okay, and I'll remove my sterile gloves, and I'm actually not going to use the drape. And I would not turn my back to the sterile field. So now I'm going to put on my gloves. And I'll scoop under this cuff. Okay, so now I'm going to set up my station how it works best for me. And be careful of the borders. Okay, so first I'm going to take the blue wrap off my catheter. And I can dispose of that. And then I'm gonna place the tip of this in the lube. Get about 2 inches of lube in there. Okay. And then I'm gonna attach my 10 ml syringe. Right here. Okay. And now I can start cleaning the peri area. Right, so first I'm gonna start by opening up the labial folds. And I'll start by cleaning the fold furthest away from me, down, and I'll discard of it. The other side closest to me and down. And then straight down the middle. Okay, and now my patient is ready for the catheter. So without moving my hand and letting the folds touch, I'm going to go ahead and start inserting. Okay, and I'm going to go in 3, 2, 1, and I'm going to push in until I get urine, and then plus 2 to 3 more inches. Perfect. So now I'm going to grab right here and inflate the balloon. 10 mLs of saline. my balloon is actually broken, so it might not hold it. Okay, so now that I've done that, I can pull back, make sure there's resistance, it's in the right spot. And I'm gonna go ahead and change my gloves. And then I would secure the catheter to my patient's leg and then hang it on a non-moving part of the bed. And then I would remove this. I can document for color, amount, I'm sorry, my cat's joining. Color, amount, size and type of catheter used. I have a 14 French, and then I would document the patient's response and the use of sterile technique. So now that everything has been put up, I have the patient's urine in the bag. I'm going to take out the catheter. So by doing that, I would put on clean gloves, get a clean 10 ml syringe, attach it here. I'd remove it from the leg. So with gravity, I'm going to allow gravity to bring the water back into my syringe, except my balloon is broken, so it might not. So I'm just gonna pull it back. All right. So I've ensured that I have my 10 mLs in this syringe, which is the amount that I put in. So I can discard of this. And on the count of 3, I will have my patient deep breathe, and I'm going to start to pull out, okay? 1, 2, 3. And I can let all the urine drain into the bag. And I'm going to go ahead and take my gloves off around here. I'll put on some new gloves. And at this point, I can perform peri-care for my patient. I will document the amount, clarity, and color of the urine collected. I'll also teach my patient that once the catheter is out, she needs to void within 8 hours, or we'll need to contact the doctor. I'll also let her know that she might have pain when urinating or difficulty. So I'll also document the size of the catheter removed, the type of catheter, the indwelling catheter, 14 French, and the patient's response. And that I collected 10 mLs of saline from the balloon. So now I can dispose of everything. Okay, so now I'm going to raise my patient's bed up. I'll be back to check on you in a little bit. I'm gonna leave now. Do you need anything before I go? Do you need to go to the bathroom? Do you need to, are you in a comfortable position? Are you having pain? Do you need any of your possessions? No? Okay, well here is your call light right here. I'm gonna go ahead and lower your bed and lift your bed rail up, and I will be back to check on you. I'm going to perform hand hygiene and provide privacy.